provided by the public health sector, by Ugandan taxpayers paying for it and the public sector providing it without international donors and without NGOs kind of filling in those spaces. That should be our goal.
Well, what has been your experience when you are dealing with a country in Africa like Uganda and you have a program where they have to co-fund? What has been your experience? Because that is my worry. That's a big ask of $600 million. And I don't know whether they'll be able to do that, or if they falter, if they are unable to provide that many, what happens to the MOU?
Well, there's various mechanisms where we can adjust over time, but the commitment on both parts, both governments, is, again, that's why we're giving ourselves time, is to these planning figures and to these numbers so that each country can appropriate, get passed by their legislatures, and plan on budget for that money so that there aren't surprises, so that all of a sudden, wait a second, I can't cover this, I don't have. We're planning now, and I should note that in 2026, this year, the U.S. is covering the cost. We're seeking Uganda's investment starting in 2027. So that gives a transition year to plan, because we're already in the fiscal year for Uganda. So it would not really be practical to say, okay, come up with the money right now. This is something that we're trying to create a glide path so that Uganda, starting in 2027, has already budgeted, and it'll be a staircase up of investment, and the same for the United States, that we can plan for, so that this is as smooth as possible. Now, I mean, ultimately, you asked about other countries and other experiences on co-investment. I mean, I think that's what every government wants to do, is they want to be responsive to their citizens and be responsible. Here in Uganda, lots of government officials have talked about that. This is taking ownership of these programs and these systems. And so our goal as a friend and a partner of Uganda is to help in that way, rather than having a parallel system that we have funded for a period of time through non-governmental organizations, to actually instead help the journey towards self-reliance, towards sustainable systems here in Uganda, again, by training those healthcare workers, by bringing them gradually onto the payroll, by utilizing technology, helping digitalize, for example, medical records so that there's more efficiencies and all that can happen faster, by training field epidemiologists so that you don't need international epidemiologists, or that you have enough people to go out and detect those diseases, stop them, and ensure that they don't have an outbreak again. All that is more efficient if Ugandans are doing it and they have the capacities to do it, and we're helping kind of catalyze that going forward.
I don't know whether you've been able to have your people go across the country and see the health system, how it
Certainly,
is.
absolutely.
Because if you look at some of the district hospitals, general hospitals, the services there, the hospitals are struggling. They're limping. Some cases, the medicines are not there. If the medicines are there, sometimes the human resource is not there. So this is the kind of system you want to subsidize.
Well, I think it's a system we want to keep helping build. I myself have been to a number of the referral hospitals, and I've gone to a number of the health centers around the country, from West Nile to Masaka to Mbale and elsewhere, all over the country, seeing these facilities, seeing where they've made progress and where there are challenges. Our goal is not to make an abrupt transition and to say, okay, here, good luck. It's rather to say, now we have 5 years to work on this in a concerted, and we're even going to invest in a surge capacity so that these systems, these health facilities, these workers have 5 years to come up to that level that I think we all want to see, and do so in a coordinated fashion and in the most efficient way possible. If we keep investing in non-governmental organizations and we keep investing in these parallel systems, we're never going to make the public healthcare system as good as it can be. So this is a historic shift because we want to see these systems rise up to the levels that I think all Ugandans would benefit from.
Uganda is a country sometimes where you find, with an integrity deficit, and sometimes money is stolen, though they can give it another name, misaccountability, misallocation, whatever, but it is stealing. So does it concern you that corruption issues could come up and maybe eat the funds?
Well, I think corruption is a challenge that's faced everywhere and is a real issue that we have to be open-eyed about. And so in this agreement, we do have mechanisms for independent audits, for examining expenditures, both countries. This is U.S. taxpayer money. This is Ugandan taxpayer money. We owe it to those taxpayers to make sure that that money reaches its destination, reaches its beneficiaries, and is spent on what it's supposed to be spent on. So there will be annual independent audits that look at how this money is spent. There's, of course, Ugandan government auditing functions. The ministries have to be examined through that system too. So we'll have multiple sources to look at how the money's being spent. We'll have the opportunity to examine it during the course of the program implementation each year. During the year, we don't have to wait until the year after to get the audit report. We'll be able to look at this together as two governments throughout the process. But yes, we need to make sure that this money is spent on what we've agreed it to be spent on.
You know what? Sometimes Ugandans can be good at making accountability without, how do I put it, without being accountable.
Well, I think that's where the independent auditor functions come in, which is, again, we need to make sure that this, number one, this money is being spent correctly. Number two, the other element of this is what are the results that we're achieving. So it's one thing to just spend the money and say, okay, I bought this amount of medicine or I paid this number of salaries or what have you. But if you're not bringing down the infection rate, if you're not extending people's lives, if you're not getting the health outcomes, then you still haven't achieved anything. So this is going to be both results and program impacts as well as that safeguarding of the resources, because it's one thing to spend the money and have it all go where it's supposed to be, but if you're not achieving the health results, you really haven't accomplished anything.
There's something that is bothering most Ugandans today is that all of us, even if you are a corporate Ugandan, we live in perpetual vulnerability. You are one medical bill away into real poverty, because even if you are admitted in a middle-level kind of hospital in Kampala, God forbid for just 1 week, and even if you're a government employee or a corporate person, whoever, chances are you won't be able to cover that bill. And that always is hanging on our heads like the proverbial sword of Damocles. Anytime it can cut. So do you share in our concern like that?
I think absolutely that healthcare has to be affordable and accessible. That's a discussion that's happening in many parts of the world, including in my country, where the cost of healthcare is a real impediment for a lot of people. And so together, I think we have to work not only on ensuring the quality of healthcare is good, but it's also affordable and that people can actually access it and achieve it. If you can't, healthcare is not something that is optional. When you need it, right? And so it needs to be something that is both good enough quality that it's going to make a positive impact on someone's life, but they also have to be able to pay for it and to be able to afford it. And so by this investment, our hope is, and our intention is, that not only will we improve the quality of it, but we'll improve the efficiency of it, which should keep the cost more controllable and more accessible to Ugandan patients.
Isn't it better to be able to invest in building the capacity of Uganda to build a health insurance system that eventually where everybody can access health care that is affordable and that is quality, because ultimately that will answer the ever-increasing question of
I think accessible health insurance is absolutely should be a priority, and that's something that we envision hopefully being able to work on through this mechanism. But that's really for the Ugandan government to decide on how they want to prioritize the use of some of these funds. But we agree that health insurance, because ultimately you don't know when you're going to get sick. You don't know when this is going to happen. So you save on a rainy day, you pay for this insurance policy. So for the moment that something does occur, it's not not catastrophic. And so most people, as you note, live day to day, including in the United States. There's been a long history of people without health insurance that they face challenges. One accident, one health condition appears, and it can be really, really financially debilitating for someone. So that role of health insurance in a modern society is fundamental, and I think this is an opportunity to help build that here in Uganda.
The worry is that sometimes you bring in very good programs, a partnership with Uganda or countries in Africa, and midway some of these partnerships may be aimed. I'm giving the example of the AGOA, because AGOA was something great for Africa, for Uganda. If you can be able to trade and build your trade, probably even the aid can stop. But midway, AGOA is suspended.
Yeah, so AGOA, as you note, is a trade preferences program that we've had since the early 2000s, about 20 years now. It has statutory legal requirements for a country to qualify. They run across a range of criteria: how open the market is, how many tariffs, what the tariff rate is on American products, transparency, anti-corruption measures, etc. So Uganda 2 years ago was determined no longer qualified or no longer met all the criteria. In the meantime, AGOA has now expired globally, so that is currently being reconsidered in the United States Congress for reauthorization. So we'll see what the United States Congress chooses to do with AGOA as a whole program. But in the future, Uganda or any other country will need to meet the legal requirements so it wasn't that the program ended per se, it was that the qualifications no longer applied here, but the opportunity in the future, of course, still exists to re-qualify.
So this health program we're talking about cannot suffer from the AGOA disease?
It's a different set work. It's different setup. In other words, that this is not set by statute or law, the criteria. We have made a decision that we are going to work with Uganda in this way, with this amount of money, for this amount of time, and that's our commitment.
It's an interesting time we're in now. Ugandans will be deciding the leaders January 15th, and people are crisscrossing the country trying to dazzle them, asking for a mandate to lead. And sometimes in times like these, we see the United States giving maybe a travel advisory about Uganda. I wonder whether they've done that already. And why would you, especially when you look at the issues? Issues seems to be okay.
No, we have an existing travel advisory that we do in every country, just to give American citizens information about the situation on the ground, where they should, be careful, whether it's crime, driving, political environment, etc. So we have an existing travel advisory that has been in place for many years here in Uganda, and it provides basic advice. Don't go to a political rally or large groups of people that might, turn in some way dangerous. Obviously follow Ugandan laws, be careful about crime. But we have many, many Americans who live here. We have many, many Americans who visit here. And we find it to be a good place.
I'm going to say this, William, I'm going to say this with a lot of respect. Yeah. Because, look, in the United States, actually, gun violence is very high. If I'm driving on the streets of the U.S. as a black man, I would be very careful how I'm going to conduct myself. Otherwise, somebody could shoot me dead. In fact, in the last elections, by grace of God, a candidate survived by a whisker. You see, it was that bad. But I don't think countries were issuing travel advisory to the U.S. because your country, gun violence in schools is like a pandemic.
We do. We have a serious challenge with gun violence.
But we don't issue travel advisories.
Well, each country certainly has the sovereign right to do so, and I think actually some countries probably do. But ultimately, that's something that the United States has to keep working on, right? I mean, and a lot of Americans have expressed concerns about that. We have very strong opinions about gun ownership in the U.S. amongst the American people, but nobody wants to see people killed by guns. Nobody wants to see violence. So there's work to do. We still think it's a great place to visit. We still think it's some place that we would love to, again, have tourism, business, student exchange. We have lots of Ugandans who visit the United States. We have a lot of Ugandans who go to school in the United States. We want to keep that going, but of course we want everybody to be safe as well.
William Pope, U.S. Ambassador to Uganda. We're going to take a break and the hot seat will be right back.
KFM's Hot Seat. It's hot, it's live, provocative, and digs deep into the issues. It's KFM's Hot Seat.
933 KFM.
The hottest debate on all relevant topics live on KFM's Hot Seat tonight. KFM's Hot Seat covers all the relevant topics. It's KFM's Hot Seat. The K-Drive. The K-Drive.
KFM, good evening.
Yeah, boss.
Guys, I'm right here.
The Soviet Center, I'm put the number.
Ani?
The Soviet Center.
The Soviet Center, yajikuwere decho, yagarachi.
Nangama to Akumugo coach and Nankan.
Oko chachi.
Envizi.
Why your chance are you, cha?
Yangambye Guayagara or more Chinese. That's a woman.
Yakukubila ku Saturday. Sijidia ku Monday.
The K-Drive. The K-Drive.
But Emeka, why this person looking for a job?
What did you want me to tell him?
You could have told him it was a wrong number. Now imagine he's going to go back Mumbo. But you say it's Saturday. Me, I'm out of here even. I don't want anymore.
The K-Drive. The K-Drive. Monday to Friday, 3 to 7 p.m. on the fresh and reloaded 933 KFM.
Trip on your phone, trip on your game, trip on your data, trip on your movies, trip on your download, trip on your TVs. Booster! Triple your blast with MTN Booster, the super data bundle that tops you off with an instant boost of 3 GBs for 3 hours at only 3K. Exclusively available once a day. Dial *100 *22# or use the MyMTN app to load and get a boost. Terms and conditions apply. Together, our fun is unstoppable. MTN Uganda is regulated by Uganda Communications Commission.
Are you frustrated with tax penalties and interest? The URA tax penalty waiver is giving you another opportunity to free yourself by clearing your tax arrears due on or before 30th June 2024. Pay your principal tax by 30th June 2026 and related interest and penalties will be waived automatically upon payment confirmation. This amnesty only applies to domestic taxes including income tax, VAT, local excise duty, rental income tax, and gaming tax. For more information, visit our website or call our toll-free numbers. Grab this golden opportunity today.
Uganda Revenue Authority. Developing Uganda together.
There are trips to the hospital, and then there are family trips to look forward to. There's the occasional health scare, and then there's bouncing back stronger. There's living, and there's living free.
Let your parents embrace the carefree golden years with J Senior. This cover is designed for seniors aged over 65 and offers ideal plans for those you love most. SMS HELP to 6115 or call 0800-211-711 today. Jubilee Health Insurance. Live free. Jubilee Life Company of Uganda Limited is regulated by the Insurance Regulatory Authority of Uganda. Terms and conditions apply.
It's to those making moves, walk into a celebration. It's time to share it. It's
Enjoy Uganda's favorite cherry, now in a stylish new look. V&A, fresh flair, same great taste. Excessive consumption of alcohol is harmful to your health. Strictly not for sale to persons under 18 years of age. Enjoy responsibly.
933 KFM.
KFM's Hot Seat. Hear the real story behind the story. Coming right at you. Only on 933 KFM.
Welcome back to 933 KFM, and this is the Hot Seat. My name is Patrick Kamara. My guest tonight is William Pope, U.S. Ambassador to Uganda. We're discussing America First Global Health Strategy and specifically the U.S.-Uganda bilateral health cooperation. And this is the moment when you can also have your say. So my producers open the lines. I'm going to give you an opportunity to directly talk to the ambassador. And the numbers to call are 0751-933-900 or 0701-933-934. Remember to keep it short, precise and concise. And in case you disagree with the ambassador, that's normal, but remember to disagree with respect. So who's going first? I have a call online. Hello.
Yes, Mr. Patrick.
Yes, go right ahead.
Good evening and thanks for that show.
Okay, go right ahead.
Yes, you're talking to a Kote. And I'm honored that I'm going to ask U.S. ambassador simple question. And it goes, first I want to thank him and the government of the US for helping our government in Africa, especially under the health sector. They have done good work and have helped our health sector to move to a certain level. Now, my concern is, as a country, we have our policy, as internal policy, which govern our government. And most of the aid you give us, there are some strings attached. Recently, when we just passed the anti-homosexuality law, you cut off the aid in the health sector, and most of the Ugandans suffered. And some might have lost their lives because we were not happy with the decision which was made by the Ugandans. Should I assume that the one which just gave us recently, there are no strings attached? And finally, a quick one, finally, you about corruption. Yes, you have invested a lot of money in our government. Doesn't this bother you? Because the money invested in has been misused. It has not been put where we cannot need to be. It has been always diverted either by corruption, and doesn't this bother you as funders?
All right, Mike recorded there. Thank you very much. Your questions, I'm sure, have been taken, and the master is going to respond to you on the matters of integrity and, of course, matters of conditionalities. William.
Absolutely. Thank you, Michael. Thank you for the questions. In the first instance, I think it's important to underscore that even when there are have been areas of disagreement at any point in time, the United States has always remained Uganda's largest and most significant bilateral partner. So even sometimes when friends don't necessarily agree on something, it doesn't mean you don't still work together, and that's certainly been the case. So while there were some adjustments in the era that you mentioned, we did continue significantly, at that time, nearly $1 billion of assistance annually that continued throughout the last few years. Now, going forward, I mean, obviously, as I mentioned, this agreement does put into place requirements in both cases to achieve certain goals, both in terms of what health outcomes we want to achieve and how much money we're going to put towards these things. And we're looking to each other to hold each other accountable. So that is built into the nature of the agreement. That's, I think, what is one of the positive areas going forward. And since it is government to government, we're going to have a lot more opportunity to work directly with each other versus, say, in the past where we've given to NGOs and that money really wasn't as visible to the Ugandan government and maybe not